Very excited to have you all here. I'm excited to do this. I am a physical therapist. I graduated in 2016 and started treating with Athletico immediately thereafter. I've been out in Indiana for about 3 years and then moved out here in March, so I'm brand new to the Valley. Enjoying the first summer here. Yeah, it just seemed like it was the right summer to come. So yes, do a lot of running. My wife does a lot of running. We have 3 dogs, and we're excited to be here. I'm excited to do this talk. I really love getting out in the community and sharing some of the knowledge I have and just getting to interact with all you guys. I do want to introduce my boss here. This is Cammie. So if you guys have any complaints at all, you make sure to tell her and things will get done about it.
Yeah, I'm Cammie Kerber. I'm the regional manager for Athletico.
Yeah. Alrighty, I'm going to remove my mask so you guys can hear me a little bit better. And we'll get started here. So, like I said, I'm a big time runner. I ran since I've been like 6 years old and ran through elementary, middle school, high school, and then into college as well at the University of Evansville. So I can't really tell you about myself without telling you about running. I love it. I do it all the time. And it's what brought me into physical therapy. I had a couple of my own injuries in high school, and that's how I got exposed to the career of physical therapy and just kind of latched onto that. Never really turned back. Running's also how I met my wife. That's her there. So I paced her through a mini marathon right after we graduated, and then proposed to her on the finish line. So, aww, that's sweet. Yes, thank you. I think so. So yeah, that's my wife there, and we do a lot of running together.
I guess you didn't run away then.
No. And to be fair, she did beat me. I was trying to get the ring out of my pocket, and she just bolted, and I looked up, and she was gone. So yeah, I had to chase her down and ask her a very important question. So that's a little bit about me. Now a little bit about Athletico, the company I work for. We're based out of the Midwest, but we are a national company. We are in 12 states now and have over 500 clinics. We are somewhat new to Arizona, but we do now have 12 clinics open in Arizona and looking to open a 13th one in October. And we're just going to keep going from there. So we're trying to make ourselves as available as possible to the Valley, just trying to spread ourselves out and be as convenient as possible for everyone. These are our core values. We just updated them last year. They're something that is very important to our company, that we stay modern on our values. This is something that we go over in all of our meetings and we talk about constantly, something that I believe in strongly and we use to guide what we're doing in physical therapy. I won't go through and read them all, but I do think they're great. All right, so let's talk about why we're here. We're going to talk about a little bit of balance, what it means to balance, what systems are we using to balance, both internally and externally. We're going to talk about how balancing occurs. We're also going to talk about what can you do to be better about balance. We're going to talk about what exercises we can do to get you better, what things we can adjust in your life or your lifestyle or your home to lower the risk of falls. And we're also going to talk about footwear real briefly. So, why are we talking about balance? Why is it so important? Well, we have some statistics here. The annual incident of falls in the elderly community, 65 and up, 28 to 35% of those who are 65 or older experience a fall in each given year. That is an astounding number, especially when we look down here as to what that means in terms of hospitalization. It's the #1 reason that people are going to the hospital once you've crossed that 65-year-old threshold. And so falls are dangerous, and it's something that, to me, is highly preventable. You can do all these things to work on your health and everything, but we don't talk about balance as much, and I think we absolutely should be talking about it. It's something that we can get better with simple exercise and simple knowledge. So, there are both internal and external reasons that falls occur. We call those intrinsic and extrinsic factors. Intrinsic factors would be things like weakness of the muscles or a gait disturbance, how you're walking. If you walk with a limp, that makes you more likely to fall. We also have things like vestibular disorders, inner ear problems, things that directly affect the balance. But when we have things like cognitive impairments and depression, things that we wouldn't normally think might affect the balance that absolutely do. We are going to only be talking about the things that I'm an expert in, and that's the musculoskeletal system. So things like the muscles, things like how you're walking, and that vestibular disorders. We also have extrinsic factors, external ones. There are things that we can largely control inside the home, but maybe not always control outside the home. So things like slippery surfaces, stairs, carpets, and then things like what footwear are we using? Are we using nice trendy sandals that look cute, or are we wearing very ugly shoes that are also very supportive? I love ugly shoes. I tell people this all the time. Get yourself a good pair of ugly shoes. It's going to support your feet better. It's going to lower your risk of falling. And then medications. I, by no means, am an expert in medication. That's why the people of Hatfield are here for you. They direct that sort of thing, not me. But I do know that there are medications that a lot of us are on and taking regularly that affect our balance. And you can see here that a study showed if you're taking 4 drugs or more, you are statistically more likely to incur a fall. That just has to happen with the drug interactions, the side effects of these medications. And again, that's something that you should really be talking with your doctors about, not me. I'll say, I don't know, drugs, that's something else that I don't do. But that's something that your doctor can talk to you about, something that you guys can manage together. But one of those external factors. So we're going to switch up to look at the internal factors. How does our body actually balance? We have 3 main systems. We have the visual system, our eyes and how we see. We have the somatosensory system. We're using big words now, but that's just what we feel through our feet or through our hands if we're using that to help balance. Then we have the vestibular system that I talked about just briefly a bit earlier. That's our inner ear and how our body senses where we are in space. All 3 of these systems are really important to be able to balance, and you really need all 3 working at a high level to maintain your balance. Individually, they can let you balance, but when one of them is just thrown off a little bit, it can mess with the other 2. It can give you things like vertigo, dizziness, those sorts of uncomfortable feelings that can increase your risk of fall. So we're going to go into each one briefly. So, who here has gotten up in the middle of the night to go to the bathroom without the lights on and been a little bit unsteady walking around? Definitely. Or even if you're just walking at night because you don't want to walk in the middle of the day when it's so hot out, but once that sun goes down, it starts to get a little bit darker, it's a little bit harder to balance. And you may be thinking, why would that be? The ground hasn't changed, I haven't changed, it has to do with our eyes. And your eyes are not getting the visual cues that it normally does. And so your body relies on the visual system by far more than the other 2. That's why when you try to do things in the dark, or if you were to close your eyes or do a game blindfolded, you find that people can't balance hardly at all. And that's all right. Our bodies naturally use that visual system quite a bit, but it would be really good if we could say, hey, why don't we train the other 2 systems so we don't have to rely so much on the eyes? Because eyes are great, but they don't always do the best. Sometimes we need glasses. Sometimes we need surgery for our eyes. Sometimes the eyes are just deteriorating. And then sometimes it's just dark out and you can't turn the sun back on until the next day. So the visual system gives a lot of input into the brain, and the brain uses that input to change a lot of our posture. So it's very important. Somatosensory system, like I said, this is the input you get from primarily our feet, because usually we're balancing on our feet, not our hands. But every now and then you'll get some from your other limbs. Say if you were walking along and touching a wall, you get a little input from there. This input is coming from the feet, and that can be thrown off in different ways. So if you've ever been walking through your grass or through your yard, or say on sand in a wash or on the beach, we all know that that is more difficult to balance on, right? It's because the ground is unsteady and our body is used to a nice flat surface like the floor here. And so you throw an unsteady surface at it and the body starts sending all these signals saying, whoa, the world is not flat anymore. The world is a little bit rocky. And that also throws off our system a little bit. It allows our body to say, and our brain to control, okay, if we're leaning a little bit this way, okay, let's turn on these muscles and keep our balance so we don't just timber over to the side. But this is a balance between the somatosensory and the visual. These have to work together. And we have one final system. Oh, I'm getting ahead of myself. All right, let's show you the differences between the visual system and the somatosensory system. So Cami, we'll have you come up here. So Cami is our lovely balancing demonstrator. We're going to do a nice round of applause for her when she's done, so be prepared for that. We're going to have you, get this out of your way.
That good?
That work good? All right. Cami is going to balance on one foot with her eyes open. We're just going to watch how she does. It's not too bad. You can see a little bit of wiggle. She goes a little bit side to side, but ultimately pretty good, right? As a physical therapist, when I'm doing my balance assessment on each of my patients, I want to see that you can balance on one foot for 10 seconds without having to touch something, without having to put your foot down. That's considered normal balance. I think Cami's about there. She's a little wobbly, but that's all right. Now, what we're going to do is we're going to put Cami on this piece of foam here. This is going to affect her somatosensory system. Okay, so now she's bouncing on here, and she's much more wobbly. You can see that, right? And we'd expect her to be. We put her on an unstable surface, but this is mimicking walking through grass, gravel, sand, and ultimately she does a pretty nice job. She didn't need to, grab onto me or put her other foot down. She didn't go flying, so that's good. And so the body can overcome some somatosensory deficits. Now what we're going to have Cami do is she's going to balance on one foot but with her eyes closed. And we're just going to keep a hand here just in case. And you can see this is a bit more difficult for Cami, which is very normal. Although maybe more difficult than I had realized, Cami. All right, so you can see her system relies very heavily on the visual. That's very normal for all of us. So when we take away the eyes, all of a sudden the body goes, whoa, how are we supposed to balance? And you have to rely on your other two systems. You have to rely on the ground underneath you, giving you input into your feet. You have to rely on your inner ear, which we're going to talk about here in a sec, and I tried to talk about too soon. But you can see how those two things are very different. So, the vestibular system. I was so excited to talk about it. We're going to talk about it now. This is a very fancy system that occurs inside the ear. It's really your system of knowing which way is north, south, east, west, even if you had your eyes closed. So if you've ever watched or played Pin the Tail on the Donkey, right? You have the kids close their eyes or put a blindfold on them and you spin around 10 times to try and disorient them, and then they go to try and pin the tail, right? They don't know which way is which because we've messed with the vestibular system. We've taken away its ability to know which way was I facing before because we've spun everything around. So it works in 3 dimensions, and I won't go into the exact science of it because it's like way up here stuff, and I would make a fool of myself trying to explain it. So, but suffice to say that there are canals that have fluid in them, and as you turn your head side to side, as you nod up and down, and as you side bend each way, that fluid is moving, and when it moves, it tickles these little hairs. Those little hairs send input to the brain, and the brain says, we are now going like this. We are now looking up. Or say if you got turned upside down in the water or something like that, it would say, swim upward for air. Don't swim downward. That's going to go to less air. So like I said, in 2 parts, the inner ear and the brain. The brain is the big coordinator of everything. And it ties all these 3 together. So we're going to do a quick demonstration with everyone, but we're going to stay seated for this, okay? So what we're going to do, I've already got it. Eileen's on it. You got it. We're going to put our thumb out straight in front of you, okay? I want you to focus on the nail of your thumb. And the first one we're going to do, you are going to keep your eyes focused on the thumb, and you're going to move your arm back and forth as far as you can while keeping your eyes on your thumb. Good. Now, you want to do this actually fairly quickly, about this speed here. And what we're trying to do is do it without turning your head. We do that 10 times. Go ahead and relax, everyone. And it can get you a little dizzy. Did anyone feel a little dizzy with just that? Okay, so if you do about 10 of those at a good speed, it can mess with your visual system. Your eyes are trying to track as it moves through. Your head is trying to stay still and just look. And so the world hasn't moved, your head hasn't moved, but your eyes are moving back and forth. If I do that for a patient in the clinic and they go, whoa, 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 I'm getting dizzy, okay, that tells me that their visual system needs some work. There's something going on there. Now we're going to do a slightly different exercise. Same thing. We're going to put arms straight out. You're going to be focused on your thumb. And this time you're going to turn your head without moving the thumb. So just kind of the opposite. You want to focus your eyes on your thumbnail as you turn your head. And again, in the clinic, I make you go about this speed. You know, that good motion 6 speed. Okay. And go ahead and pause. Did anyone get a little dizzy with that? Yeah. All right. Usually it's pretty common with that one. That one is the vestibular system, and that's the difference between visual and vestibular. Visual is where the eyes are moving back and forth and the head staying still. This one, the eyes stay focused and the head move back and forth and that fluid push back and forth. If that was enough to throw you off, then we know that the vestibular system is what's affecting your balance and something that we need to work on. So, when these systems are not firing at their best, it can affect your balance. But it's not just that. It's not say, oh, I haven't worked on my vestibular system here recently. It can actually be as much as, now my vestibular system is giving me the wrong inputs. Those sorts of dysfunctions cause a lot of dizziness. They can cause vertigo, where you feel like the whole world is whirling around and you can't control it. And it causes motion sensitivity and even blurred vision. The most common thing that I think people have probably all experienced is if you ever have had a bad head cold or a sinus infection, how just even laying in bed, you're like, okay, why is the world spinning? And it's because there's so much pressure in your ear, it's affecting that vestibular system, and it's giving input to your brain that you're moving your head even though you know you're not. When you get input that says that one thing's happening and the other systems say, it sure isn't, that causes a lot of internal fighting in your brain. It makes you very uncomfortable. It's what causes motion sickness on planes or ships, where you feel the ship moving underneath you, but you look out at the horizon and nothing's really moving. Your body does not like that. So we have a lot of people taking Dramamine or the patches or just hurling overboard. That's a very common thing. The systems want to work together and work together strongly and agree with each other. So this is a very important chart. It's important because it's here to show you just how smart I am. It's a big chart that just says stuff. That's okay, it was a joke, you could have laughed. All it's saying is that we have the 3 systems of sensory inputs. They all go into the brain. The brain processes that information and then it tells the body to do something. It also says that these are working backwards and forwards. Okay, you're getting input from the systems through the brain to the body and back and forth, and that ultimately results in balance, or at least that's the goal. So if one of those systems isn't doing its fair share, you can see how with that flow system there, it could clog something up. And if you've got a clogged pipe, it's going to affect the whole system. So how would we assess your balance? Well, we use a couple of those tricks that we did that I showed you already, whether that's balancing on one foot, balancing with the eyes closed, balancing with the foam. We test the vestibular system by turning your head back and forth. But we also do functional assessments where we say, okay, how long does it take you to stand up and walk to the 10 feet and back? How long does it take for you to stand and shift to another seat? Do you have to use your hands to do that? And so we talk about these functional things where we're really looking at, if you're at home and you have to do these tasks, are you safe to do them? And we do this a lot after major surgeries to make sure that people are using their new knee correctly, but we also do it when people come in and say, hey, I've had a fall, I want to prevent falls in the future, what can we do to do that? So we use those 3 systems to look, but we also do the functional assessment. So And this is something that we would use. You can see here, this is the same exercise that we did, but you can use a card. And you can see just how little this lady here is turning her head. So I showed you that in our assessment, I force you, because I'm mean, to turn your head way side to side, and I make you do it fast, okay? That's because I really want to assess, is your system at 100%? You can see she's barely turning her head, right? She's just kind of going like that. And so that's where we have people start. If their system isn't online yet, we go real slow and work you up into it. We've got some exercises that we're going to hand out for you guys to work on at home. And that's how I want you to approach those exercises. It's not starting at 100% yet. I don't want you to go home and go, oh, I'm balanced now. You know, that's not going to be good. We want you to start slow and just say, okay, this is causing just a little bit of dizziness, but that's okay. A little dizziness is fine as long as you stop and overcome it. If you go back and forth and shake that head until you're crazy dizzy, that's not helping you. That's just making you go, why on earth did I do this? Yeah, exactly, because I made you. No, so you want to start slow and build your way up with these exercises. It's important to put these into your regular exercise routine. Balance is so important. And it's important not only to have those three systems working, but also to have your body working so that it can respond to those three systems. Like I said, the three systems are putting input to the brain is processing, and that's telling the body, how do we balance? Okay, so if your three systems are doing great, your brain's working just fine, and it tells the body, but we've got a body that's going bleh. We don't have that core control. Well, all that's for nothing then, because you're not able to balance. You can't perform the muscular actions. And so balance is important not only to work on the systems, but also to work on the muscles. The nice thing about balance is that if you work on balance, you're going to improve your core strength. If you work on your core strength, you're going to improve your balance. They're going to go hand in hand. So let's talk about how do we challenge these individual systems. The first one's the visual system, and the most obvious way is simply close your eyes. But if we're not quite ready for that, we saw how great Cammie did with her eyes closed. That was really a struggle for her. She might not be ready to do eyes closed yet. What she might need to do is balance, say, with her feet in a tightrope position, and then work on looking side to side, nodding up and down. Those sorts of things throw off the vision too, because you're not able to focus on a specific spot. Those are easier and safer ways to challenge your balance. Now, I'll say this a few times today. When you're working on balancing at home, start in the chair. Okay, work on these exercises where you're turning side to side. Work on these exercises until you feel safe with them. Then when you go to do them standing, please, please, please do it where you got something to hang on to. Something like a countertop where you can put a hand down, or a handrail that you can grab onto. Do not go to the top of your stairs, stand on one foot, and expect things to go well. That will turn out badly. So we can do things to obstruct your vision, and one of them is even talking. So if you're standing and balancing, and you go on one foot, oh, well, I'm doing pretty well. If you are working on just balancing feet together, and you think, I'm doing pretty well, but I want to challenge myself a little bit, start talking to someone while balancing. It actually throws off your visual system because you stop focusing on what you're looking at and you focus on what you're talking about. And so if you don't want to talk to someone while you're balancing, turn the TV on even. If you're watching the TV while trying to balance, it'll mess with your balance a little bit.
I talk to my TV.
You talk to your TV?
Yeah.
Does your TV talk back to you?
No, my dogs do.
Well, feel free to talk to the TV. I don't know how well it's going to go, though.
I always talk to my TV.
There you go. And so the next system that we can work on is that somatosensory system, the input into your feet. How do we challenge that? And so we showed you the fancy foam pad like we have in our clinics, but you may not have that at home. You don't need to go buy one. You can simply go stand in the grass, say right next to your porch where you can hang on to something. You can do it by putting a towel down in the kitchen and stand on the towel. If you have an old pillow that you're not planning on sleeping on anymore, you can use that. Don't use your pillow that you sleep on. Yes?
With or without shoes?
So that's a great question. I prefer without shoes. I want your body to be able to sense through the foot and not be obstructed by the shoe. And the shoe is going to help give you some support if you're wearing good supportive shoes. So let's challenge without. Yes?
Okay, I have Charcot,
Uh-huh.
which is a neuropathy,
Correct.
and I don't feel, my feet are numb.
Correct. So your somatosensory system is very affected right now.
Well, not only that, I'm deaf in this ear and tone deaf in this ear.
Well, so you've got a couple of systems that aren't working at 100%, so it's much more important that you work on your visual input. Are you going to get a benefit from doing the somatosensory training? Maybe a little bit, but you're not going to get that input through your foot. Can the rest of your body give you some input? Can your knee and your hips and everything? Absolutely. Are you still going to benefit from practicing? Absolutely. But yeah, those sorts of things are normal. Neuropathies are normal. Deafness, all that sort of stuff. Yes?
What are you trying to do here when you do these different things? Train your organs or retrain them?
That's a good question. I like these questions. They're good. So, train them. Usually we are not retraining unless something has gone very, very wrong. Okay? The only time that we would retrain is if you had a very serious injury and your body was giving you the wrong input. And so that would look differently. We need more specific therapy to do that. These
Like
basic,
after a stroke?
like after a stroke, when your body is giving you the wrong inputs. We are more giving you exercises that are going to help train a system that on its fundamental level is doing the right thing, just maybe not at the level we want it to. Does that make sense? Perfect. So, like we talked about, you can put down a pillow or a piece of foam or a towel. That'll help challenge that balance. And then we can also challenge the vestibular system a little bit. We already talked about this a little bit. If you're balancing on one foot, you can add in some head turns. You can do it a little bit faster. You can start to throw off this system and force your body to use that one system only to balance you. That's going to be very difficult. And so the point is that there's a lot of ways to work on your balance. You want to start with just challenging the one system at a time before you start getting more and more crazy. But if you're doing this and you're saying, hey, my balance is pretty good, I want to challenge it a little more, that is when we start combining techniques. That's when we say, all right, Kenny, let's get on the foam. You're going to balance on one foot on the foam. Now we're going to have you close your eyes. Okay, now eyes are open. You're going to be on the foam and you're going to start turning your head back and forth. Okay, now you're going to be on the foam and I'm going to have you count to 100 by 4s. Those sorts of things to start challenging the different systems together. This is a little more advanced, but it's an option for you if you're saying, my balance is pretty good, I've done your basic exercises, and I want something a little more difficult.
At that point, could you be confusing your head?
Absolutely you could, and that's the goal, okay?
Oh, okay.
Is that if you are balancing on one foot and you're doing head turns, you go, oh man, my balance is not good. It's because you've confused your brain. You've sent a lot of input into it, and your brain has to be able to learn to trust the systems that are giving good input and block out the systems that are not giving good input. So if you're on one foot and you're turning back and forth, your brain needs to learn to push out the vestibular and take in the foot inputs and say, that's the input I need to stick to. So yes, you can confuse the brain, and that's a good thing. So we talked about the importance of this a little bit already. It's going to improve your core strength. You need core strength so that your body can actually perform the balance. The tree analogy here, trees don't grow their limbs out nice and wide until they have a strong trunk. Okay? It grows up first and then outward. We're the same. We have to use our core muscles and develop that strong core strength, that trunk, before we can expect to be on one foot, before we can start doing crazy things with our arms and not lose our balance. The other one I like to tell people is think of a pirate ship and the cannons they had on them. If you saw a pirate ship fire its cannon, you'd see the ship move just a little bit, right? It's a powerful shot. But imagine taking that cannon and putting it on a canoe. If you fired the cannon from the canoe's going to go flying. And that's kind of the same thing. If you don't have a solid, stable core, doing these things can really throw off your balance. And so, like I said, the core is that solid base, something that we need in order to balance. The nice thing again is that if you work on your core strength, your balance will improve. If you work on your balance, your core will improve. They go hand in hand. So that was a lot of things about the internal factors. Let's talk a little bit about the external things that you can do that don't require training. They're just looking around the house or seeing someone to help improve your balance. These are the kind of gimmies, I feel like. So you can, first and foremost, go see a physical therapist. They would be happy to assess your balance and say, hey, you're looking great. Here's some exercises to make that better. Or, you know what, this needs some work. Maybe we should have you come see us for a couple weeks to work on this or that. You can also work on your core system and work on flexibility. Those sorts of things are going to help to improve your balance. Reviewing your medications with your doctor, that's a big one. If you have 4, 5, 6 different doctors who are saying, okay, we need you to take this for this, and this for this, and this for this, and you just say, okay, they're right, they know what they're doing, but you don't have someone, a primary care like Hatfield Medical provides, who's going to look through your medications as a whole. You can get a little bit of drug interaction or side effects that start affecting things like your balance. So it's a great thing to have a resource like this where you can come in and say, hey, here's my list of medications. Can we go through them and see, are there any issues with taking all of these? Are there any possibilities of me losing balance because of it? Other thing would be having an eye exam. Like I said, the eyes deteriorate as we age, just like everything else. We need to make sure that we're keeping track of those eyes because we rely on our eyes so much when we balance. If those are going a little bit shoddy, it's going to really throw off your balance.
You rely on your ears too.
You rely on your ears, you rely on your feet, you rely on all three, but visual is generally over half for most people. All right, home modifications. At this point, we should be working to have a nice, clean, tidy home, right? We don't want clutter on the floor. When we have little kids at home and they have all their toys, they're everywhere, and those are tripping hazards. If you have small dogs at home, they are tripping hazards, and they have their toys. So these are, like I said, these are gimmies. Can we just get the clutter out of the way, make sure that we have a nice clear path from the bed to the bathroom so that we're not going to step on anything in the middle of the night? Make sure there's adequate lighting. This is one that people don't think a lot about. They're like, oh, my room's a little dark, but that's okay. I like it dark anyway when I sleep. Okay, make sure that you can get the lights nice and bright when you need to, because without them on, our visual system's a little bit deteriorated. Then things you've heard before, keep cords out of the way and keep them tacked down. And a big one, if you are being advised to use an assisted device like a walker or a cane, please use it. Don't be the person who goes around and says, well, I just kind of lurch from the couch to this chair over here. Because that might work 9 times out of 10, but one of those times you might miss. Okay, just use the assisted device that you're being asked to use by your doctor. And so lastly, let's talk about footwear. Okay, I said at the beginning, I love ugly shoes. Okay, we actually are at a stage in life here where you can have a shoe that looks nice, that also is supportive. But traditionally, those shoes that are most supportive are the ugliest. And so I tell people all the time, get some ugly shoes. Things that you're looking for when you're buying a shoe, you want a shoe that goes all the way around your foot. Something that's going to close around your foot all the way up to the ankle. I was picking on Cammie on the way here. She has a very pretty shoe on. Isn't that nice? But it doesn't cover her whole foot. Okay? And so inherently, there's not a lot of stability with that shoe. Can I have your shoe? Can you take it off real quick? All right, everyone hold your breath. All right. The other thing about Cammie's shoe is that it's a very flat and hard sole. It's not something that's very supportive, so we want something that is firm, but gives you some support under the arch. This is something that doesn't help to give her feedback from the ground. So you want something that's going to cover up the whole foot. You want something that has a flat sole, not a whole lot of this heel action. So that's actually a good thing for Cammie. It's not a big old 6-inch heel. And then a nice rubber sole is something that we're looking for as well. Back to Cammie.
See, I have a high instep. That's what Charcot is.
Yeah, absolutely.
I have Charcot 1, and my son, it's hereditary.
Sure.
My son got it, and he's got a big dome around his foot. bunch of his bones died, and he has a very high instep. That's where I have a hard time finding shoes.
And it can be
I cannot
difficult.
find them.
It can be very difficult. So what I tell people,
is the only one I found that I could do.
sure. A lot of times what I'll tell people with Charcot or who are having difficulty finding a nice supportive shoe is actually go to a running shoe store. You don't have to be a runner to go to a running shoe store, but they have very supportive shoes, and they have people there who are more than happy to look at how you're walking and find the shoe that fits your foot the best. Something that's going to give you good arch support, help your high instep, whether that's an insert or the
Yeah, I
shoe
had
itself.
a guy, Dr. Chappie sent me to Hanger, and they had
Sure.
an insert for my shoes, and it's
Absolutely.
soft, but it's firm. And
Absolutely.
that puts it up into my arch.
Gives you contact with your foot, and that's what we're looking for out of these shoes. So, like I said, if you're looking for a good supportive shoe, those running shoes are actually a nice way to go. I wear running shoes all the time. We're not actually supposed to at work, so you can tell my boss on me. We're supposed to wear, fancy shoes like she's wearing, but I always wear a supportive shoe. I think it's important for the foot. I think it's important for balance, and if I'm preaching this, I better be practicing it. So I do not wear fancy looking shoes. I wear supportive shoes. The last thing about the shoe, you want one that has a nice wide toe box. Don't cram your feet into shoes. You may have done that when we were a little bit younger and we wanted that glass slipper to wear. Don't cram your toes in there. That's not good for them. You want your toes to be able to spread out. When we put our hand down to brace out, we spread our fingers out because we're looking for a lot of support. Our toes do the same thing. If they have room to spread, they're going to, and that helps with your balance. So, there are lots of things we talked about today. We had the 3 systems that cause your body and your brain to know how to balance. We have the visual, the vestibular, and the somatosensory all going to the brain. The brain's processing it and telling your body, how do we balance? Those are the intrinsic factors. We have the extrinsic factors in terms of what medications are we taking? Is there clutter around the home? Are there area rugs that we could maybe move so where we're not going to catch the lip of it with our toes? Those gimmies that we can change easily to improve our balance. And then we have the shoes that we wear. Are we having something that covers the whole foot, gives you good support, helps to meet your arch, and is hopefully a little bit ugly and not too pretty? Those are the things that I think are going to give you the best results in terms of balance. Certainly, if any of you have any questions, I'm happy to answer those. And certainly, if you would like to be seen in any of our clinics to do a balance assessment, we are happy to do that. Though we would need you to go see your primary care doctor first to get that referral.